Hello, everyone, and welcome to Refresh. I was always happy to be together, to value this time, right? Where we can connect, be inspired, learn something, and ultimately feel a bit better for this time spent together, because this is what Generation W is all about. Just curious, has anyone been food shopping of late? Any kind of shopping? Perhaps get gas for your car? Oh my goodness. Do you not notice? How could you not? Prices are rising and it is noticeable. And I can tell you, I'm feeling the pinch in my purse. How about you? Right? And it's concerning because between the supply chain issues, and by the way, let me ask you a question. Whoever thought that supply chain issues would become a regular part of our vocabulary, right? Pre-pandemic. There's a lot of change. And it definitely has a double meaning, because in many ways, we're getting a lot less change back for our dollars today. But in the macro sense, our lives are continuing to feel the impact of seismic changes initiated by the pandemic. And I have to say, every day I spend a little time trying to get my head wrapped around the swirl. What's really happening? What's really good about this? What's not so good about this? What do I need to understand? But today, let me just say this. We're going to focus on the best way to deal with everything and all that life can throw at us, because it's the most precious asset we have. And that's our health, right? It's something we do take for granted. And as women in particular, most often the family and community caregivers that we are, we provide the least amount of care where it can matter most. Yeah, say it out loud, everyone, for ourselves. So I am so happy today to introduce three amazing Mayo Clinic, professionals for sure. Two of them are doctors and one is a registered and licensed dietitian. How's that, Haley? That's pretty good. And what I love about all three of them is they are so devoted to our best care. Matter of fact, when we were talking about some of the topics we would cover, I loved when Dr. Sahni said, our passion is to help women, because the more women know, the better off we all are. They all come from differing disciplines, and may I just add how much we value not only the gift of having a Mayo Clinic in our city of Jacksonville, a destination for health solutions for patients from around the world, but the valued partnership we share with Generation W. So thank you to everyone at the Mayo Clinic. And today in particular, we say hello to a women's health specialist, Dr. Sabrina Sahni, a neuropsychologist, Dr. Beth Rush, and clinical dietitian, Fritz. Hi, ladies. How are you?
Hi, good. Happy to be here. Thanks for having me.
Oh, of course. Now, as we're gonna get into this, I thought it would be really helpful if any of the women who've signed up, or anyone on Facebook, let's see who's on Facebook. We always like to say hello to them. Want to let them. What is your number one health concern for yourself? Just put it in the chat and put it on Facebook. We'll raise it. But I'd like to start with Dr. Sahni today, if we could, because you are in particular focused on women. What are you seeing that is of concern, and also that is pleasing to you about our overall care of women in today's world?
I think so. Part of what I do is a lot of menopause and midlife women's care. And I will say that over the last, maybe 5 years, I've seen this kind of drawn attention towards the menopause transition, which I think has really been lacking amongst, education and medical schools and medical training, to be quite frank. I think we're prioritizing it more. I think we're acknowledging that this transition happens, and we're actually providing appropriate support for women during this time. That kind of goes into my passion for prevention as well. I'm family medicine trained. So quite frankly, I feel like prevention is key. And the more you know about your body and the changes that may be coming up, the better you can prepare for them and tackle them as they happen.
So. You talked about two things. One, we're talking about things we've never talked about before.
Yeah.
I know that Dr. Jackie Thielen, who is a friend of all of us and also a tremendous clinician and advocate for women, is on. So hi, Jackie.
Hi, Jackie.
So we're talking about things we didn't talk about before, but this idea of secrets, like being aware of what's going to happen in your body. I didn't grow up that way. It's kind of like, oh, no one told me this was going to happen. Or maybe if they did, I didn't exactly listen.
Right.
Dr. Rush, how about you? Your overall, we're going to come back. We're going to talk a lot about that. I just thought I'd give everybody a chance to talk a little bit about their specialty and what they're observing in the world. So Dr. Rush.
Well, I'm a neuropsychologist, so people often ask, well, what is that? And I look at how people adjust to different neurologic conditions That might be stroke, that might be brain tumor, that might be medical illness that affects thinking. So I'm very interested in trying to build people's toolboxes to manage, cope with, and deal with whatever comes their way.
Whatever comes your way. And there's a lot that's been coming our way. So let me ask you if it's people dealing with obviously the pandemic and all of the uncertainty, the constant fear of getting ill, and actually the reality of a lot of our family getting ill and perhaps experiencing more serious illness and death than we ever thought we ever would in our lives.
Yeah, I mean, we're all preoccupied with health-related concerns. I mean, we're flooded with information on radio, TV, social media about the pandemic. And so it really brings into question, how do you limit your exposure to that so that you don't become so hyper-focused that you neglect important things in your life, including yourself? And how do you live well during a time when things are uncertain? So I think it could be helpful for women to learn strategies for tolerating uncertainty, regardless of whether life is certain or uncertain. I think this pandemic has been kind of an in vivo experiment for all of us to learn what we can do to make uncertainty something we can tolerate in the long term.
Okay, so you asked the questions. We're going to come back to them because I know all of us want to know the answers to what are the strategies that we can learn how to tolerate the uncertainties. We've been dealing for 18 months, but before we do that, I want to say hello to Haley Fritz, registered. Before we came on, I asked her, tell me what it means when you're registered and licensed, and you did. Tell us a little bit about you and what you're seeing these days.
Yes, absolutely. I'm so happy to be here. As women, we are so full of responsibilities. And the one thing I notice often is we don't, the first thing to go is ourselves. And along with that is our food choices. And, it's easy to go towards the quick, the convenient options, but they're not always the healthiest. So I really do like to emphasize that healthy eating can be simple. It can be quick. It can be convenient. I also like to focus on a toolbox and just having those little things that will get you to that healthier lifestyle it's going to work for you. So just taking those little steps to get there.
That's great. I also want to say hello to Ashley Pratt, who is a great partner of ours. And she's excited. She's, of course, grateful to all of you who works at the Mayo Clinic. Thanks, Ashley. And Ashley, I'm sure you're going to have some great questions here. All right, so let me open it from each perspective. I think it's really interesting because we have to worry about what we eat, what we bring into our bodies. We have to worry about what's happening with us neurologically and psychologically. And of course, as first a family physician and now women's care, let me start here with you, Dr. Sahni, because I've always been concerned that we as women have been treated as just another body as opposed to a unique specimen that has all of its own unique hormones and internal physiology that makes us different from men. And yet it's been slow to be recognized in the medical field.
Absolutely. I mean, I think for many, many years, women were kind of seen equally as men, especially when we look at medical research, right? So we didn't have a lot of data that was just pooled, that was dedicated to just women and women of midlife or women of certain ages. And I think over the last couple of years, we're starting to see and recognize some of these gender-based differences in medicine and actually trying to recognize them. It's sparking conversation, which I think is what we need. And hopefully kind of will help us move towards the future of healthcare for women in particular. I think to echo what you said initially, I think women, we are the primary caretakers for our family, for the community, for those around us, and we tend to neglect our own health a lot of the time. And so I think having conversations of just what to anticipate, knowing when to say something about your health are really, really important to kind of talk about daily.
And all right, what should be the top of that conversation? What are the things that we should be raising first and foremost from your perspective?
So mental health is a big component. I think of women's health in general or just health in general. I think that that's something that, has definitely gotten a lot more, something that we're talking a lot more about as it relates to menopause, understanding small changes in your body and not neglecting them as something that could just be something that's supposed to be quote unquote natural, or some process that you just go through. I think, there's a lot of resources out there in the community, and to talk to your doctor about these things can help you feel empowered, and normalizing the experience in general.
Right. Okay. So I don't think menopause has really been a subject at all. I will say this. I did work on a Hollywood movie a couple of years ago, and the name of the movie was Hot Flashes. And I know it's funny, right? And you probably can find it in some like old library. And it was a movie about older women who played basketball when they were younger and now came together to help one of their teammates who had just found out she had some kind of illness, which is funny, but that was the title, Hot Flashes. That was about as close to anyone who's ever talked to me about menopause through our life. So where you talk about resources, where can women find them? And listen, people didn't even say the word out loud.
I know.
At work, women who of a certain age, looked like if they acted a certain way, their bosses thought, oh my goodness, they must be hysterical, or something must be happening to them. It created this divide or expectation, and Beth, impacting how people perceive mental health here.
Right. It's interesting that you say that, because I was actually listening to a podcast probably a couple of months ago from the Harvard Business Review by Dr. Heather Hirsch. She's a colleague of mine, but she talked about recognizing and normalizing menopause in the workplace. And I actually thought it was really fascinating. We tend to, great that in the last, several years, we've really catered to women in the postpartum period as they kind of, navigate back to work, as they breastfeed, as they need time to do things. But what about the women that have decreased work performance because of these hot flashes, right? That are, rather debilitating, that 80% of all women when they go through menopause really suffer from. I think it's something that we need to really normalize across the board, not just in the workplace, but, in everyday lives. Because I tell women, every woman that lives long enough is going to experience this. The fact that we don't have dedicated research for it, the fact that we aren't acknowledging it as something that actually exists is a problem, I think. Good resources to kind of touch back on what you initially, I recommend the North American Menopause Society is a great resource for women and for physicians or clinicians who are interested in menopause. They've got great articles. And then certainly here at the Mayo Clinic, we have a great women's health department that can certainly help women kind of navigate during this time.
Oh, without a doubt, one of the best. And isn't Dr. Stephanie Fabian very involved in that national?
She is, yes.
Society? Right?
Yeah.
I think I saw her book someplace about that, which is pretty
special. Yeah. They just had a big national meeting not too long ago that was excellent and kind of presented a lot of the most cutting edge research and data we have for menopause. So,
which is fantastic, right? Why don't we do this before we go, because we have people on Facebook who have raised some of their issues, which actually totally tie into all of your expertise. But if we could, Dr. Sahni, let's look at your 3 tips for all of us on women's health self-care. All right, so let's start with understanding our bodies. Do we really understand our body? I remember growing up, this is going to really age me. What is it? Our bodies, ourselves, and it was seen like as a really kind of super out there, like how could anyone even publish that book? I think we've come somewhat of a way, but do we understand our bodies?
I think it's an ongoing evolutionary thing. We're learning and understanding our bodies as we go along. Things are happening, things are changing, the environment can play a factor. And so I think it's an ongoing lesson that we're learning, but I think the ultimate thing is to not neglect prevention. So, right, we have preventative measures in place to help us detect things sooner, right? So I work here at the Mayo Clinic Breast Center, and part of what I do is I work with women that may be at high risk or even average risk for breast cancer and talk to them about mammographic screening. With that being said, there's prevention for all different other types of chronic disease. So things like colon cancer screening, cervical cancer screening through routine pap smears, for those that are a history of chronic smoking, lung cancer screening, and then our routine blood work, right? So what does our blood work tell us about what we may be exposed to down the line in terms of chronic disease risk? So really not neglecting prevention and understanding that as we age, things will happen, but making sure that we're really prioritizing ourselves. that kind of goes into my second point. I don't know if you want me to go there yet, but I do think it's kind of a whole integrative head to toe experience of mind, body, and soul. Exercise, I think, is probably one of the most underused treatments for really just anything from depression and mental illness, to fighting off chronic disease, to cancer risk reduction, to really everything. I think there's a lot of power in just movement and moving our bodies. We know that on a cellular level, physical activity can decrease inflammation and decrease, certain growth factors in the body. It can improve our immune system, which keeps us healthier. And I think we need to really prioritize just movement every single day.
Movement, absolutely movement, conscious movement, right?
Right. And it's not like you have to go out and run a marathon. It's just moving your body consistently every day, right? Taking an extra flight of stairs, walking, going for a walk with a girlfriend, whatever that may be, but it's consistent movement, and it really goes a long way.
Yeah, I will tell you, every now and then on the weekend, I get to walk with some great girlfriends, and it is so fantastic because it does exercise all of those things. The conversation helps you do that, right?
Yeah, awesome. Absolutely.
All right. And your integrated view of women's health?
So again, kind of head to toe across the board. So it kind of ties into that mind, body, soul, which I touched on a little bit, is really that we really need to address all different factors of women's healthcare, whether it's mental, spiritual, physical, to really optimize women's health.
So let me just say this. When we say do not neglect prevention, I don't know how about you guys feel. All right, I'm going to put the docs on the and Haley, I'm going to put you on the spot. Do you feel like you neglect your own prevention?
At times.
Mm-hmm. I think it's a natural thing. I think it's an easy thing that can happen. I'm guilty of it, and I'm sure many of us that are listening in have also been guilty of it, but we have to remind ourselves that we really need to prioritize our health, because we want to be the best version for ourselves and for our family, for our friends, for our loved ones.
For sure. I know for the pandemic, all of a sudden I'm like, oh, and time travels like this, right? So quick. We're all so busy. And so I called one of my doctors, and they said, oh, by the way, you haven't been here in so long. You need to be a new patient. I'm like, wow. Well, I have not been, by the way, that wasn't the only one that happened with. And I'm thinking how easy it is to fall into disrepair. And allow something bad to happen, right? Because I didn't go have a very essential test for a very long time, which was not good. Trisha Mealy says, we're going to go here right now because Lisa Morrow says hello from Facebook, and she says brain health is very important to her. And Trisha Mealy is acknowledging your comment, Dr. Sahni, by saying, as a brain injury and rape survivor, movement has been essential to my healing. And you know what, Trish, at some point, I think we should come on and share your story as well. But Trisha gets out there. I've seen her walking on the beach. I think she's also done some races and stuff, but honestly had to reconnect her body and mind to the world after some, I guess, a really terrible injury. And I'm just so happy she's with us all the time. She brings so much. So to emphasize your point, absolutely. But let's talk a little bit about brain health, Dr. Rush. There is, we are all concerned about it. Of course, every day I put my cell phone to my ear. I'm worried about whether I'm impacting my brain.
So I think an important part of women's health is recognizing that stress doesn't just happen to our emotions, it happens to our body. There's a very tight relationship between body and mind. And so that is not just kind of an anecdotal finding, but it's actually part of the way we're wired. So our body has what you may have heard of as an autonomic nervous system. And the autonomic nervous system has a sympathetic part and a parasympathetic part. And in lay terms, what that is a fight or flight response and reaction, which is evolutionarily very important to us. If we encounter a threat, we're able to be pumped full of adrenaline with a response that allows us to get out of the way of threat. And then hopefully the parasympathetic nervous system can dive back in and help us relax and get back to some kind of homeostasis. Well, there are many different ways the brain-body stress reaction can be triggered. Sometimes it's as simple as an infection, a bad cold, or a bad night's sleep. It can be pain. It can be psychological trauma. It can be a neurologic injury like a stroke. It could be breaking a foot. It could be losing a partner. It could be having a friendship go bad. It doesn't really matter what triggers the response, but then the body starts to respond in a way that can lead to inflammation and can lead to exacerbation of baseline physical problems. So it's not just as easy as manage your stress. It's understand that stress is uniquely experienced in a multifaceted way. It's experienced in your thinking, it's experienced in your emotions, it's experienced in whether your pupils dilate or not, and whether or not you can control your tremor, whether or not you can have a fluent conversation, whether you can maintain relationships. So, I mean, the work that is out before us really relies on having a toolbox that's full of many things. Preventative care, good sleep, good exercise, and making good choices and slowing down enough in our busy lives to be mindful about the choices that we make. And I know our dietitian will have plenty to say about that. You know, what I emphasize with people that I treat so much is to say, where are you? Where is your mind? Where are you at? What can you do right now to respond to your basic needs? You know, self-care doesn't have to be going to a spa, having a blocked hour, and like getting a facial or a massage. Self-care can be turning off the lights of your office, sitting in your chair and saying, where's my head at? Forgive the dangling preposition. My husband would have a heart attack. But my point is that, you know, you have to build mindfulness into your daily life. You have to do things with intention, make appointments, you know, to see Dr. Sahni and her colleagues, do that intentionally and without fear. Being able to eat well and make good choices, to slow down enough to savor the food that's in your mouth. These are things that, you know, women are tasked with a lot during the day in all of our relationships and roles. And it's not easy to do, but it's so important to do because stress is felt across the brain, the body, the mind, and the soul.
I am responding more slowly to that, Dr. Rush, as I am mindfully taking it all in. And, you know, I think we should put that on tape and replay it often.
Listen, there are days where I have to say it every 5 minutes to myself. Where are you right now? What are you supposed to be focused on? How do you feel about it? And what's distracting you? We're easily distracted. It can't just be me.
Not only are we easily distracted, right? But we have daily presence of activities that are designed, right? Designed neurologically and to appeal to all of those systems in our body to distract us constantly. It's called the internet and social media.
Well, one question I have, Donna, maybe for our audience, is if there are any educators in high school, middle school, junior high. I think that one thing that I never got that I think would be so important for young people to hear early on is how do you take care of yourself? No one's ever going to say, Donna, you're so busy. Why don't you slow down and take a nap? Why don't you slow down and drop a few of your responsibilities? That is something you have to do for yourself. But no one ever pulls us aside, male or female, and tells us how to do that. And that's, you know, we're told how to eat, we're told how to sleep, but no one ever says it's okay to put boundaries on your time. It's okay that if you receive an emotionally charged text or email to say, gosh, I got to think about that. Let me get back to you. And by doing that, I mindfully create space that allows me to really think through my reactions and what my options are.
Yes. And, you know, it's funny. You said no one tells you. My mother, who happens to be on this, tells me that often. Don't you think you should slow
Good for her.
By the way, she does have a question. She doesn't have video. She wants me to ask. If you're 85 or older, do you need a mammogram every year?
So that should, can you hear me? Oh, yeah. That should be a discussion with your doctor. So it depends on a lot of different things. The American College of Radiology actually doesn't put an upper age limit in terms of discontinuing mammograms. It should be an ongoing discussion with your physician. Now, if you have risk factors for breast cancer, if you have increased breast density, if you have even a history of breast cancer, you may be still getting annual mammograms, but you can have a discussion with your doctor regarding, do you want to do this every year? Do you want to do this every 2 years? And one big question that sometimes guides that conversation is, if you were to be diagnosed with breast cancer in the next 5 years, what would you want to do, right? Would you want to know about it? How would you want to treat it? How aggressive would you want to be? And sometimes you have that kind of really open discussion about things, and that can kind of drive the conversation. But again, it really should be individualized with every single person.
Ooh. All right. Now, thank you so much, Mom. There you go. And I know that's kind of cute. Dr. Rush, why don't we take a look at your mindfulness toolbox, and then we're going to come to you, Haley, because Jakimber Martin says the big things on her health mindfulness list are weight and high blood pressure, easily influenced by food. But let's look at the mindfulness, the healthy toolbox, your mindful toolbox. All right.
All right. This isn't an easy one, but good boundaries with relationships. Boy, is that important, and can be very hard to negotiate. Obviously, we read this and we think about good boundaries with relationships with other people, but we also have to have good boundaries with relationships with ourselves. So being able to say no, being able to not take on responsibilities that we can't do with good integrity, or being present with those responsibilities. So boundaries are very important ways to be assertive about your self-care. Without boundaries, you can't pursue self-care. So that's my first tip. Routine sleep and exercise is just very important. It doesn't take much for our threshold to be reduced to let stress in. And if we're not sleeping well, we're not moving. I love what Dr. Sahni said. It doesn't have to be much movement. It could just be a walk. It could be moving around your house to do an activity, but that's important for kind of managing stress. And I guess finally, my last tip would be recognizing what you can't control and being okay with that. Tolerating uncertainty, learning tools like meditation, like mindfulness, that it can help you feel like you have a sense of agency to get through something that you can't control, or a situation with parameters that you can't come to terms with, that you can't affect.
We can dig deep into all of those. I feel like we're going to need a couple of sessions here, ladies. But let me just say this: you reminded me of something to do. Usually at during halftime of the show, I want to remind everybody, we want to welcome you to Refresh. Today we have amazing professionals from the Mayo Clinic giving us incredible insights about how we can be our best and most healthy selves. One of the things I'm hearing loud and clear is movement, movement, movement. So Ashley, with your permission, what I'd like to include in every show from here on in is we'd like to take now a Mayo movement moment. Everybody, if you're sitting at your screen, you got to get up and just shake it out, turn around, whatever, right? There we go. Woohoo! Because right? There we go. Ash, what do you think? It's really necessary, right? Because we're all sitting in front of our screens. I don't know about you, my legs go dead, and then it's not long followed by my brain. So thank you for that so far. Thank you, Jakimber, for your raising the issue of weight and high blood pressure. And Haley, we know how much what we intake here, right, impacts those issues as well. So tell us a little bit about nutrition, which again seems to be heightened in the conversations that we have every day. I'm not sure that, the cookie's sitting downstairs waiting for me.
Hey, it's all about moderation, right?
Okay.
That's my favorite rule. Well, to be specific about weight, I specialize in weight loss and bariatric surgery as well. So this is a great topic to me. But it all starts with a balanced diet. And I think when we talk about a healthy diet or weight loss, we don't know where to start. And that's the biggest question that I get from my patients is, what do I do? Is this diet okay? Is that diet okay? And, we lean towards the newest, biggest thing. Don't eat this. This is going to cause weight gain. Try this supplement. And it can be very overwhelming. It can be very confusing. And I like to say, go back to the basics. And, a healthy, balanced diet will never go out of style. It's a great place to start. And if we have more specific conditions that we want to focus on, like lowering our blood pressure, managing diabetes, heart healthy diet, that would be a great conversation to have with your dietitian on how can I manage these items through my diet. And I always practice nutrition as individual. There's never a specific diet for one person or a specific diet that's going to fit everyone's lifestyle. So it's about, again, creating that toolbox, finding those moments that are going to work for you, and kind of getting away from the term diet and just focusing on a healthier lifestyle. I think that's more manageable to focus on than, specific rules of foods that we can and can't eat. But rather looking at everything we can eat, we'll just go back to that moderation rule. So definitely going back to those basics, a balanced diet can be a great place for everyone to start.
But what does that mean? Because, listen, we're all on the internet. I'm literally amazed on Instagram. I think every other ad feels like lose weight fast, lose your belly now, lose this, eat here, don't eat here. I mean, it really is mind boggling, right? We have the Pritikin, we have the protein, we have don't eat carbs, don't do this. And when you say basic, I don't know if I understand the baseline of basic anymore.
Yes. The one tool that I love to share with my patients is the My Plate. So I know I grew up with the healthy food pyramid, and the new look of it now is in the shape of a plate. And that really helps us simplify exactly what we need to eat every day. It shows us we need room for a protein, and, varying that protein through lean meat sources, incorporating more plant-based foods. Then we move on to the grain category. And this is, again, one we kind of shy away from is, I can't have my carbs, but they're really important. They're on that plate for a reason. We want to make half of those grains whole. We're going to get more nutritional value from those. And then, of course, we have half of our plate for our fruits and vegetables. And a great rule of thumb I like to follow for that side of the plate is eat from the rainbow. And that just tells us eat all the different colors, because you're going to get so much nutrition, different vitamins from those different beautiful colors of your fruits, of your vegetables, choosing whole sources when you can. So grab the apple, grab the carrots, something that's not as processed, kind of stay away from the baked apple chips. That whole apple is going to be better for you. And then there's finally a dairy portion on that plate as well. So if you can tolerate your dairy, we recommend choosing some lower fat options. But all of those parts of the plate are, really important to our diet. They help us maintain a healthy diet, and they help us balance out each food group as well. So with weight loss, one thing I talk about often is portions. So we don't want that whole plate to be grains, a plate full of pasta. We still need to balance it out with maybe a little side salad, get a little grilled chicken in there, and that meal will still be very satisfying.
Yeah, we talk about portions a lot in our family too, and they're large.
Yes,
okay.
Especially if you go out to eat.
And Kelly, congratulations to Kelly. She just lost 50 pounds in 5 months. Wow. But she cut out all of her carbs. So she hears what you're saying now in terms of needing to balance, right? I think Jackie asked a question. I'm not sure what it was. I think it was probably related to menopause, but I'm going to ask it to you as well, Haley. Supplements, vitamins. There are people that think all your vitamins you should get in your food, and there are others that said, no, we actually need more vitamins that we can get through taking vitamin pills. Where are you on that?
Yeah, so I absolutely think starting with a healthy, balanced diet is key. A multivitamin is a great supplement to that in case some days you are lacking in certain food groups. As far as going further into specific vitamins, that's something I encourage you to speak with your physician about. Generally, it's based on your lab work. We'll know, do you have a low vitamin D? Is a supplement necessary for you? And that's where we would start. As far as herbal supplements, this topic can get a little tricky. for example, green tea extract. I actually had someone stop me in the store the other day and ask me, and they had no idea I was a dietitian. Turmeric and things like that are becoming very popular, especially for weight loss. But normally I say if it's too good to be true, it usually is. And with those supplements, they're generally not regulated. The dosage can be off, and it can, in some cases, be toxic. So I would generally stay away from those supplements, again, unless your doctor has prescribed them to you specifically.
So you really want them to talk to us. Now, one other question, but then we're going to go to your nutritions and tips. We talk a lot now about personalized medicine. And I think I mentioned to this, and I'm sure other people are seeing personalized diet, like having taking your blood and then looking at the analytics that says, this is what your body metabolizes better. You should be eating this, this, and this for a healthier you. We can tell what's going on in your biome, which seems to be like the most talked about topic of the day. Can you translate a little bit of that for us?
Yes. So as far as the blood type goes, this is a topic I've been hearing a lot lately too. And as far as the research I'm aware of, it's still very, very limited. So to jump into a blood type diet, it's not something I would recommend until we know more. As far as the microbiome, so interesting. If you haven't gotten into it, we have a colleague here. She specializes in GI nutrition. So I know she's been following that more specifically and kind of sharing here and there with us. And it's definitely something that's coming up and I think will make a huge impact. But again, very early on in its research. So we're all waiting to hear how that develops.
Okay. All right. Because we do read a lot about it. Let's look at your nutrition tips and tricks, Haley, because we've gotten so many other great tips so far today. All right.
Yeah. So focus on a balanced meal. I know I talked about this one a lot. That goes back to the My Plate and just getting every food group on there. Each food group has its own benefit and the balance is key. If we're going to maintain our muscle mass, maintain our vitamins, have a healthy GI tract and so on, getting a little bit of everything in there throughout the day is important. Returning to the basics of healthy food, again, going back to the whole food sources, your lean proteins, your fruits, your vegetables, your low-fat dairy, and your whole grains, and then going from there. So we want that balanced, healthy meal, and we can specialize that based on what your goals are. And maintain good hydration. And this is one I feel is very underrated. We don't often think to drink throughout the day. We have very busy lives and it's one thing we don't think about until the end of the day. We're like, wait a second, I think I'm really thirsty. But that's just so great in overall keeping a healthy weight, keeping a healthy mind, but stay hydrated.
Does it have to be water? As you can see, I do drink all day. Well, certainly through this, but I have my tea. I have my mint tea leaves custom grown out in my garden. Does it have to be water or does that suffice?
It does not always have to be water. Beverages I would not include towards a hydrating status would be anything with caffeine. I would try to avoid carbonation when possible, and high amounts of sugar.
Wait, you would have carbonation?
I would not. It's more of it's going to fill you up. It can alter how you express hunger. So if you have like a seltzer water, I would count that towards your hydration status, but we have to be careful in how that affects our other senses.
I think Kelly's also trying to all of us, shall we not eat fried foods? I mean, French fries is, it's a treat. And what is your take on zero sugar sodas?
Oh, two great questions. So fried food, not something I would recommend have very often. It's very heavy in some unhealthy fats that we want to limit in our diet. But this is where I generally apply that moderation rule of 80-20 or 90-10, however you want to look at it. But I would take that 10% of your week, which is generally about one meal, and that can be your splurge. So whatever you choose, whether it's fried foods or dessert or maybe a sugary beverage, that can still be a small percent of your week.
All right. Well, we will take that. Dr. Thielen did raise the issue of supplements for our brains as well, Dr. Rush. Every time I can't remember something, I'm like, oh, it must be time for me to take Prevagen, which I have no idea what it is other than I see it on commercials all the time. So tell me, do we need, what kind of supplements will help our brain function better?
Honestly, managing your stress, getting good sleep, getting good exercise, those are the things that have consistent class 1 evidence of showing some kind of impact on your cognitive function if you're healthy. I have a good colleague, Dr. Melanie Chandler, who works in the HABIT program, which is healthy actions to benefit independence in thinking. And it's a program designed for people with memory problems and their partners, and focuses on lifestyle. She actually just recently gave a talk about brain health and supplements, and brought up an important point, which is if they were that good, then we wouldn't be seeing Alzheimer's, and we wouldn't be seeing a lot of problems that we see with thinking as we get older. I think any supplements should really be carefully discussed with a primary care physician. Some of those supplements aren't regulated by the FDA and can cause other problems in a person's system with their liver or kidneys. And the potential of any yield that they may have in positively impacting our memory or improving problems may not be worth it.
Okay, so I guess that Prevagen thing is out. In terms of how that works, I'd be interested to hear more about brain health and supplements and what we can all do. Is there a water to weight intake ratio for how much somebody should properly hydrate? I know that I've always heard all my life 8 glasses, but then I saw a study recently that was 4 glasses. But what do you think? What do you know actually, Haley, on this?
Yes, there actually is not a specific recommendation for hydration. We generally practice between that 48 to 64 ounces per day. That 64 ounces will be the 8-ounce glasses. Again, it's very individual. So just assessing for signs of dehydration is where I would start, which could be dry skin. It could be fatigue, the color of your urine as well. So starting there and just falling within that ratio should be great.
Listen, a lot of us have gotten air fryers lately. Does that yeah, look at
I love an air fryer.
Okay, does that kind of diminish the frying aspect of it? Is that okay?
Yes, it's actually a great alternative to fried food. You use about 90% or more or less fat in that cooking method. So I think it's absolutely a great alternative if you still want that texture of a fried food. Absolutely.
Okay, so Jakimba, thank you for that question, because obviously we all just got permission to use our air fryer. We don't have that much time left, but what I'd like to do is ask each of you, I mean, you've given us all your tips, but listening to some of the questions and the flow of the conversation, what would you like to leave us with as an enduring, mindful consideration as we leave you today? Dr. Sahni, what do you think?
Sure. So, I mean, kind of going back to the Mayo Clinic movement piece. I mean, I think if anybody in the audience has an Apple Watch that dings every hour that reminds you that you have to get up and stand, and as annoying as that is, and sometimes you're even standing and it tells you that you need to be standing and moving, is actually listening to that and being mindful of moving your body every single day. I mean, I think that really goes a long way in terms of overall health.
Okay, so back to the movement. How about you, Haley? What would you like to leave us with?
I think leaving you with just keeping it simple. Nutrition doesn't have to be hard. It doesn't have to be restrictive. And just listening to your body and taking that moment for yourself, focusing on that healthy meal, knowing that it's going to improve you at the end of the day. And that's the person we really need to focus on.
Great. And Dr. Rush?
Slow down, which is the opposite of my name. Slow down. When you're chewing, think about your food and the tastes and the senses. When you're talking to someone, think about the privilege you have to connect with someone. When you're working on a task, think about how wonderful it is that your mind still works and you can move towards an outcome. Be kind to yourself and slow down, slow down.
Boy, that is so hard in the world we live in today, right? And it makes me really reflect on our workplace, what's happening there, the great resignation, the great migration of workers, all of us asking these questions, and then how do we integrate the necessities of a workforce and a labor force, and our health. And you can see now why it's so important that they're being integrated more and more, which heretofore has not really happened, which we all know. So this is incredibly important for all of us. So thank you for all of that. I took some notes, and I love the question of, where is your head at? Because if you take that moment just to ask, you got to slow down just to think about that, which is really terrific. And that stress is uniquely experienced in a multifaceted way. Right? The fact that Dr. Sahni talked about how important it is to normalize some of these conversations to get them out there, and her work to do that is really important. And of course, yes, in terms of moderation in what we eat, as you're talking, literally, I'm thinking about, okay, what am I going to eat next? How am I going to do that? Can I have the cookie? I really don't want the cookie, but I think what you're telling us is think about it logically and with moderation, and we should be fine. So I really do appreciate all of those comments. And of course, moving forward, we must move. So guess what? We will now, moving forward, do the Mayo Movement Moment. I'm going to do that all the time. Hey, girls, in our office, it's coming to us. It's coming to an office near you and to a Zoom near you. Let me just say in closing, thank you to all of you. We really appreciate it. And of course, to Ashley and Dr. Thielen. I saw Perrin Rubin, who works in social work with transplant patients at the Mayo Clinic. All of you for joining us. And Trisha, we'll be back on the 23rd, believe it or not. 2 weeks, we have another wonderful session. But let me say this, these conversations are what continues to define Generation W and our work to educate, and inspire, sorry, Dr. Rush said, slow down. Got it. And our work to educate, inspire, and connect women, girls, and community. Generation WOW, our Teen Girl Leadership and Mentorship Program, has become more essential than ever, as we've seen, as the human connection is really at the focus of our health as well. We probably could talk about that more for another time. It's hard to believe that 10 years have flown by and Generation W continues to be a labor of love for so many of us. And it's certainly a passion. It's one that has enabled us to build this fantastic community of so many from so many different places, and where we all are united in our desire to be our best and help others to do the same. And so we're celebrating this impact of 10 years of Generation W. And then this is October, right? So it's the 10th month. We launched it on the 10th day, and we are going to try to amplify it by 10x. So it's called the 10-10-10x campaign. So for 10 days, we're celebrating all the great work of Generation W, and we'd love for you guys to contribute in any way you can or anywhere you know, so that we can continue to do this work, deepen it, and broaden it. We thank you, Mayo Clinic, for being so really engaged and positively involved with Generation W, because we know it's community difference making, people difference making, and it's what we do, and it makes a difference. So thank you so much. We'll be back in 2 weeks. Thanks to Generation W Board Chair for this great introduction, to Sarah Blanchard and her co-founder of the popular podcast. Yes, it's called Dear White Women. There's Misha and Sarah. They've just wrote a book that was published called Dear White Women. They have been working in the space of community and race relations and diversity for quite a long time. They have quite a following. We had a chance to visit with them and said, listen, I think that our community would love hearing from you. Once again, thank you, Dr. Rush. Thank you, Dr. Sahni. Thank you, Haley Fritz. Thank you, Sherry Levin, our producer, and all the team at Generation W who contributes to make this opportunity flow as it does. And to all of you who joined us, we'll see you again. And as we said, remember, Mayo Movement Moment, be kind to yourself. Take care.